Hi, my name is Rachel Vidito. I will be presenting a case study for the course SPCE 638, Section 803. The client names and identifying information has been adjusted for this presentation to be HIPAA compliant and maintain client confidentiality. So the client description for this case study, the client is male. He is 5 years old. He is currently receiving 20 hours a week of group ABA, and this takes place in a mock classroom environment, which is geared towards the ages of about 4 to 7 and really focuses in on skill level. And then also attends preschool 15 hours a week in a general education setting. His diagnosis is ASD, autism spectrum disorder. Currently, he has not been given any comorbid diagnoses, and he was diagnosed at the age of 3. He's had ABA services for 2 years and also speech and occupational services for the last 2 years. Deficits identified in the verbal operants were in the following skill areas: tacting and intraverbals. These are identified using the VB-MAP assessment. So the intervention will be targeted at the skill area of tacting. The intervention used is multiple exemplar training, and then this was also paired with an echoic to tact transfer. So for example, an SD would be given dog while holding the picture of a dog. Client would echo dog. Instructor, good, what is it? Client, dog. Multiple stimuli would also be presented to teach the same tact. So if we are teaching dog, we're going to show multiple different stimulus cards, all with different pictures of dogs. The verbal prompt is gradually faded until the client can independently say dog upon just seeing the picture of the dog. So the echoic verbal prompt is no longer needed. So stimulus class and teaching procedure. The stimulus class being used in this case study were animals. Examples, we taught dog, cat, pig, horse, along a few other animals such as elephant, lion, mouse. Teaching procedure used, we used errorless teaching, multiple stimuli for the same tact, so multiple exemplar training, prompt fading, and then the transfer procedure, which was echoic to tact. So errorless teaching, and that we are providing the echoic to teach the tact, so showing the stimulus card of a dog, dog, client, dog, good, what is this? Dog. Multiple stimuli, as we just talked about, we were making sure to use different stimulus cards for the same tact. So different pictures of dogs, different pictures of cats, and then also prompt fading was used. So initially teaching dog, dog, good, what is it? Dog. Over time, once we're getting that consistent responding, we're fading that verbal prompt, showing the picture, duh, client saying the full dog, good, what is it? Dog. Eventually being able to fade down to just having the presence of the visual stimuli and the client being able to tact dog, which is the transfer procedure echoic to tact. And then derived stimulus relations related to this case study, there were 2. Symmetry and reflexivity. So symmetry refers to if A equals B, then B equals A. A specific example related to this case study, if the client learns to say dog when shown a picture of a dog, then he can also learn that when someone points to a picture of a dog, he says dog. So sees a picture, dog, someone else says dog, points to the picture. And then also reflexivity. So this refers to an untrained match sample being learned. So A equals A when that has not been explicitly taught to the client. So an example related to this case study, through using the multiple exemplar training, a client is able to say dog when they see a dog outside of their house. Or they are able to say cat when shown a novel picture of a cat. So being able to identify and match without explicitly being taught those matches or those stimuli. References I used, I referenced the Cooper et al. Textbook, and that was the only one. Thank you for joining me for this presentation. That's all I have.